You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in hair transplant surgery. With us, we have an expert on the topic. He is America's hair doctor. It is Dr. DeYarman. Dr. DeYarman, welcome to the program.
Thank you.
Now, we say America's hair doctor, but this is all you do. I mean, you've been doing this for how long now?
Over 30 years.
30 years. Now, why is it you like this procedure, hair? Because anticipating this interview, I have buddies that are plastic surgeons and different guys. They say, I don't like this procedure. It's tedious work. Why do you like doing it?
Well, hair restoration is a micro world. I mean, you're working with hairs, 1, 2, 3 hairs at a time. You're working under a magnifying lens to see your work. And when you enter that work, you're in your own world, doing your own thing, restoring something that somebody lost. Very appreciative of what you're doing, and the patients are always happy with the results.
Is that right? How popular of a procedure is it, by the way?
Well,
do you know any stats on that?
Number one surgery for men, cosmetic surgery.
Is that right?
Right, because it starts at such an early age. You know, no man looks at the mirror and says, God, I'm finally losing my hair,
Yeah, because I told you on the phone, I said, but, not everybody's bothered by it. And that's how you responded.
Exactly, and most men will tell you, I can remember years ago when Rogaine came on the market, and I was doing transplants, and I would try to get my friends, why don't you consider hair transplants? And they'd say, well, it doesn't bother me. But yet when Rogaine came on the market, they're the first guys asked for it, I said, well, I thought it didn't matter to you. Well, if I could, help a little bit.
And you like Rogaine, right? I mean,
I think anything that's legitimate, Rogaine, Propecia, there are new other drugs that we're using now that helps treat the problem. All of it should be utilized.
Okay, because you have a thick head of hair. Do you use some of that stuff on your hair?
No, I don't. No, this is my own natural hair. And I used to have more. I could show you old photos of myself where my hairline was even lower. So, we all lose hair as we age.
Okay.
It's just, more severe and more rapid for some than it is for others.
Now, we're talking a little bit about your bio, your background, your training. You've been doing this 30 years, and you speak now internationally, teaching other doctors some of the new techniques.
Correct.
Tell me about that.
Well, I recently got back from a trip to Korea, Seoul, Korea. And I been using a product called PRP, which stands for platelet-rich plasma. And it's basically was developed for orthopedic surgery. It got over into plastic surgery, and then hair restoration surgery. We started using it, and you're drawing a patient's own blood, spinning it down, getting the plasma with a high concentration of platelets. You inject these platelets in the area that you're doing surgery. Well, these platelets have a lot of growth factors, stimulate what we call angiogenesis, new circulation.
Are there stem cells in there?
And some stem cells.
Okay.
And then, you'll get a better outcome as far as your surgery is concerned. And
more outcomes meaning what? More hairs
faster heal.
Heal, okay.
More hairs grow in, and more hairs grow in quicker than they normally would.
Now what about the redness that you get?
The redness will resolve much quicker with PRP. Normally I would see redness last 10, 14 days. With PRP, I've seen it resolve in as little as 5 days.
So you're teaching other guys how to do it. Now you've been doing that for how many years?
Well,
a couple years now?
Almost 2 years now for the PRP.
So you use it on every procedure?
Pretty much. I think it should be standard of care. I had one patient that I couldn't do it on, and he was a Jehovah's Witness.
Okay.
Because they're not allowed to do any alteration of blood.
Okay.
And so I couldn't do it. But otherwise, everybody, gets the PRP.
And is this true, by the way, that very few guys in America, surgeons, doctors that are doing hair transplant, they're not doing this?
No. I think in California, I'm the only doctor using PRP that I know of. There's probably a handful of us, maybe 10 throughout the world, that's doing it. And in next September is our next meeting, our international meeting, and I'm going to talk on PRP again.
The hair meeting with all the doctors.
Yes.
So platelet-rich plasma. I know they're doing that in facelifts and wound healing and things like that.
Exactly. And when you can see the benefits, and it's interesting, every patient that I've done a second procedure on that the first time didn't have PRP, and the second time did, are amazed how much faster they heal, how much better the results were.
So is this true, by the way? Okay, because we've talked before that you put a certain amount of grafts in, a percentage take, and some don't. Does this PRP make more last in there, stay in there, or is it more about wound healing and downtime?
I think it's Both. I think you get better wound healing, that shortens the downtime. And as far as the results are concerned, it appears that we're seeing more hair grow in faster.
So faster.
But, it's how do you judge this? Because in hair restoration, people say, oh, how many of these hairs grow, how many that don't? You don't know. Because there's no scarring, there's no evidence, oh, there's one that grew, there's one that didn't grow. It's the illusion. And with PRP, I'm seeing the illusion of more hair.
Okay. Now you're using another product as well.
Right. Now this I've been doing about 6 months, and it's called ACell. And this is a extracellular matrix product, which means when the body is healing itself, normally in surgery, a scar tissue is created. With the extracellular matrix product, the body will recreate similar cells in the area, so there's less scarring. It's an interesting video of the ACell use where a man had cut off the end of his finger. And they treated the finger with ACell. And not only did the ACell initiate the growth back of the finger, but it also, the fingernail grew back. So
Okay.
it's pretty amazing stuff. So it's new. It's being used a lot in plastic surgery. And
So this is all for better outcomes. Obviously,
Exactly.
anybody watching this video, they're bothered by their hairline. So if you're going to do it, and so my question is, why aren't all the doctors doing it this way, by the way? I mean, it's not a lot of money. I mean, I guess, $600, $1,200, $1,500 to do it the right way.
correct.
Is that right? Is that your
That's
feeling
right.
about it?
Right. And most people, when you explain and show the benefits, guys always want the best.
Well, plus you want to go back to work quicker.
Exactly.
As well.
Exactly.
Okay.
Well, people don't want the problems. I always amazed when people come in and you're trying to estimate how many grafts they need, and you say, well, I could maybe do it for $2,500, but $3,000 would be better. They always want $3,000. They always want the best, the most.
The 3,000.
Exactly.
So how often do you do this procedure? I mean, you do this just about every day in your
Right.
practice?
I do one patient a day, and 5 days a week. And the patients get there at 9 o'clock. It takes at least an hour just to prep and lay out what you're going to do, how many grafts you're going to do, how much donor tissue you're going to go. And then from there, it's about 5-6 hours of time in the patients there. For the first 4 or 5 hours, they sleep, so they're not really aware of everything, and they're very comfortable. And then the last few hours, they're watching television.
Okay. Now, by the way, how much art is to this? That means the doctor's eye looking at it and deciding the hairline.
Well, that's there's
I mean, in 30 years, I mean, can you look at a hairline and say, I know how to make this thing look natural?
Yes, but I also use aids to do this.
Okay.
I videotape it, I photograph it, I download it on the computer, I use Photoshop, add hair, and educate the patient. The patients will come in, especially the young guys, and they'll want a hairline, for example, way down here. And you have to show them that if they did that, they would look absolutely ridiculous. And so it's the profile shot is so helpful because you can see what you would look like from the side, realizing it would not, it would be ridiculous if you did that.